We've spent hundreds of millions of dollars to improve public health in this country. And there was nothing wrong with the concept either. It seemed rather odd to divide New Zealand into 20-odd district health boards, but each with their own bizarre and often labyrinthian way of doing stuff. Oversought, I guess is the right word, and administered from afar from Ministry of Health boffins and bureaucrats in Wellington. And the system never really worked. The public health system of this country, we had a perfectly good public health system in this country in the 1960s, 70s and 80s. And then this rather stupid idea came around, the more market concept of Roger Douglas, that there needed to be competition, which was a model in the corporate sector, then the public sector, that doesn't really work. Do we really need to compete? So they divided up the country in two, and if you remember rightly, first of all, there were regional health authorities. There were 4 of those. They were the funding agencies, so the government gave them the money to purchase services. Now, I know it just seems ludicrous in hindsight, doesn't it? To purchase services from what were then called Crown Health Enterprises. The Minister of Crown Health Enterprise at the time was one Paul East. He actually died last week, poor guy. Nice enough chap. Who looked at a map, actually, and realised that Rotorua, of which he was the Member of Parliament, didn't have one, so instantly created a Crown Health Enterprise for Rotorua. I know. It was that thinking. So they had a Ministry of Health, and that was apparently responsible for the policy. They had Treasury, which would give these regional health authorities the money, 4 of them. These would purchase health services from Crown Health Enterprises. And the idea was the public-private sector, but it never worked out that way because the private sector's not really big enough and it's run by private health insurers. So they sort of retreated from that idea. And ta-da, it didn't work. Out of that, they then created district health boards. They got rid of the RHAs. They sort of subsumed the Crown Health Enterprises, the cheese as they were called, and they turned them into district health boards. And you would have had one wherever you were. There were 3 in Auckland, I remember. There was Auckland, there was Middlemore, or sort of Manukau actually, I think it was called. There was it something West Waitakere? That's right, Waitakere, and there was Auckland. Auckland had 3. Does that make sense to you? No, of course it doesn't. But Wellington had 2, 3 if you included the Hutt Valley, and then they were sort of scattered all over the place. Wanganui had 1, Hawke's Bay had 1, Wairarapa had 1. Who else? Taranaki had 1. Timaru, it was called South Canterbury, I think they called it. The Maori name, Aoraki, had 1. It was all like, it was just a disaster. And what was happening? When it was terms of delivering public health, it got worse and worse and worse and worse. And there was never enough money in the system. They would pay money on, and each of the district health boards didn't cooperate with the others. In fact, they were in a sort of war. I kid you not, I sat on a district health board for 3 terms. We were at war with our neighbouring district health boards. We were competing for everything. We were competing, all right, with public money against other public agencies. So you were actually in this war over demarcation. I remember we used to draw a line down Bulls and say, they can't come to our hospital because they belong to Palmerston North, or the Manawatu, I think it was, District Health Board, and heaven for Betsy, I think it became known as the Mid-Central District Health Board in the end, heavens to Betsy, if they come here, they'll be taking money from us. I know. It was madness. Each of them has their own IT system. Oh, can you imagine that? Can you imagine that? I mean, IT people are the smartest people on the planet anyhow. But I mean, I'm sure they're very good at IT, but don't, for God's sake, ask them to think conceptually or strategically. They're not made that way. They're brilliant on the detail of working out how a computer works. Don't ask them the big stuff. But each of them, had their little fiefdom of IT in each of their district health boards. What happened next? Food. That was another one. Each had to have their own food. God, the whole idea that you might have some synergies of any of these things. And each of them fought for, and I mean it was a war, every bit as intense as the Ukrainian-Russian conflict. Each of them fought for the specialists and clinicians who worked within their boundaries. How'd you go next door and you go, come over here, bit of extra money for you. We know we can't pay you because that'll upset the Mecca. And that was the other thing. It was completely unionised. It still is the public health sector. So if one dude over there gets one radiologist over there, or one radiographer, or one occupational therapist, or one nurse in one area, let's just say in a rural area, and you want to, there's not enough in Greymouth because no one wants to live in Greymouth, don't blame them. And you pay a bit extra. Suddenly, because you've paid that nurse a little bit more in Greymouth, the relativity flows through the whole country. And there's some nurse in Auckland sticking up a hand going, I want more. I'm entitled. We signed this agreement. There, I've explained the public health system to you. Unsurprisingly, finally, in 2022, and you have got to give some credit to this government, this government decided, you know what? This isn't working. Oh, that's good. It's only taken you 40 years to work out. This isn't working. We should sort of go back to the old system. I mean, sort of, because we've got this sort of co-governance shit. So did I say that? Co-governance nonsense permeating through it as well. So we're not going to go through it the old way. We'll introduce the co-governance model too. So they've set up Whatu Ora. I mean, even the name's risible. It sounds like something that I do after I've had a can of baked beans, doesn't it? Whatu Ora. And they set that up, and then they've got up the Maori Health Authority as well. And Whatu Ora is designed to sort of, in a funny sort of way, go back to the old Department of Health of the 1960s, 70s and 80s, which seemed to work quite effectively. And the idea is that you can then start to say, well, we can't afford cancer services or child cancer services for all the country. They go there. That we'll do hip replacements there, blah, 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 and then we can recruit nationally so we can put people in all the shortages that they are. How's it going so far? It is a disaster. It is a disaster throughout New Zealand, the public health sector. ED times are the worst they've ever been. What's the ED? Emergency department. So good luck if you head in to get injured this weekend, because you'll go into an understaffed emergency department and you could be like my 90-year-old mother-in-law, wait 8 hours before anybody sees you. Be in a corridor somewhere and no one's allowed to come and see you because the hospitals have got all their rules that you can't come in and go out again. So you can sit there with not get fed, not have a cup of tea or coffee, not have anything. You can just have your polystyrene piece of water that they gave you when you arrived and sit there for 8 hours. Welcome to the New Zealand public health system and emergency departments in the country. For God's sake, don't get sick. If you are sick, get on a plane now at an international airport, go to Sydney or Melbourne, and you'll be seen quicker. Isn't it insane? But that's our public health system in New Zealand at the moment. We've spent hundreds and hundreds of millions of dollars trying to make it better. And do you know now what it's doing? The public health system says everything's fine. The new Minister of Health, Aisha Verrall, she says everything's going tickety-boo. They were thinking of calling the army into Northland, and it's still there as a live option, don't get me wrong, because they can't handle the health needs of Northland. This is the Northland Hospital, based in Whangarei. They were thinking of calling the army in there all of last year, and still are. It's right there on the emergency checklist, because they don't have the staff for what's coming through their front door. And here's the but. But Aisha Verrall says, okay, 99%, she said this week, of people who turn up at the Northland ED are being treated within the statutory period, or they've got a sort of guideline period of 4 hours. So you'll be in and out of the ED at Northland in 4 hours. This was entirely news, I might add, to the Northland Emergency Department and all of the clinicians and nurses who work within it. Wow, that's bollocks, they said. This is entirely news to the people of Whangarei and the people of Northland. They didn't realise that they had their hospital so efficient because they're still sitting in the cafe 3 days later, not being treated. But it's all right. Aisha Verrill said 99%. Where did these figures come from? And it's similar, sort of Pollyanna-ish view of New Zealand health system coming out, came from Te Whatu Ora. Given to the minister and said, listen, everything's fine. Today, after people went, that's bollocks, and I mean they went, that's bollocks from just about everybody, from Shane Retty, the National Opposition Health spokesman, right through the line to all the clinicians and nurses, to the cleaners, to the orderlies, to the administrators of virtually every hospital in New Zealand. After they'd all said bollocks, with a capital B, Aisha Verrill said, this isn't right then. Perhaps I'll just get them to check. What? You paid $300,000 a year. If they gave you this crap and it said 99% of people are being treated in Northland, surely you should just have a smidgen of intellect that would be wrong. No. Oh no. I'll repeat it and parrot and say everything, everybody, and you nasty, beastly people undermining public confidence in the public health system. Aren't you all horrible? She said, basically, to the opposition when they raised the waiting times issue. Yes, it's a disaster. So I'm all just saying to you, if you do get sick this week, if you get injured, good luck waiting for an ambulance. And then you, of course, have to pay for it afterwards anyhow, which is just, I'm sorry, that's not a public health system. Then two, or they'll charge you. Nobody ever pays, do they? I mean, I got my $90. I just ignored it. I said, bugger off. I'm not paying that. I'm a public health system and I was injured. I was in pain. It's your job to take me to the hospital. Nah, here's your $100. We want that now. I'll put debt collectors on to you. So that's where our public health system is. And if you do get injured this weekend, please do not go to a New Zealand public hospital. In fact, I'd almost say this to you, and I mean, listen to me. Go to a naturopath. You'll get better treatment, and at least it'll be instant. You'll probably die. No, you won't die because you're drinking water, so you'll be all right. At least you'll get your water. My 90-year-old mother-in-law would have got her drink of water, wouldn't she? If she'd gone to a naturopath. Would have been one up on the Dunedin Public Hospital.